Academy of Fixed Orthodontics has appointed D-Smile Academy as the clinical training center in Malaysia. We have long-term and short-term clinical courses in orthodontics.
We have lecture and demonstration classes, and Dr. Ravi Kumar, Director of AFO New York, will be taking at least a few classes for every batch.
You make the bracket upside down for the lateral incisor, will the tip change? We know that the torque changes from positive lingual torque, palatal torque to labial torque, negative torque. So does the tip change? What we have for in the MBT system, we have the lateral incisor with 8 degrees of mesial torque. Mesial tip. So I just wanted to check this with a, try this on the model here. I'll show you. So in fact, I wanted to do this for all the biomechanics aspect of the treatment and plan to do that soon. So if you look at the bracket here, this is the left side. So you can see that the straight wire is touching the gingival and mesial tithing of the slot and the disto-incisal tithing of the slot. So this works like this. So you have the force more on the mesial and gingival tithing and the distal, so the distal and incisal tithing. So you have the mesial tip expressed here. The slot is slanted, the bracket is slanted, and you have the straight wire going through this, and the torque tip is expressed like this. So let's see what happens if we put this upside down. There you go. So you have the same situation where the straight wire in a pre-adjusted bracket, you have the mesio-gingival tithing and the disto-incisal tithing in contact with the straight wire. So you still have the mesial tip. Now let's see what will happen if we change this into the right side. So that's the right side. So you have it here. Let's see here, in the right here. Again, the same situation where you have the mesio gingival tithing in contact with the straight wire and the disto-incisal tithing. That's a part of the slot. So you have the teeth moving like this, expressing the mesial tip. What happens when we do upside down? The same situation. So you have the distal mesio-gingival tithing and the edge, not the tithing, in fact it's the edge, but it's the tithing, and then you have the disto-incisal tithing. So you can do upside down without changing the tip. But can we change the side? So as I have said before in the class, the sides are not interchangeable. Let's see what happens when we change sides. So you have, this is the right, and now let's go to the left. So the right side bracket is placed on the left side bracket, left quadrant. And you can see it becomes opposite. You have what you have here is a distal tip. So the sides are not interchangeable, but we can do upside down bracket. Thank you.
Dr. Priyank Seth AFO New York Honorary Faculty Malaysia is our dedicated faculty in Malaysia to mentor you in orthodontics.
Personalized Faculty Supervised Mentoring, FSM. First time in Malaysia, AFO is introducing its highly successful Faculty Supervised Mentoring, FSM, where the faculty will come to your clinic and mentor you on all your cases. T&C applies. You need not worry about your cases at any point once you enter our course. You can even get few cases together on the same day so that you can maximize the faculty visit.
Holding, suppose I mark somewhere and I hold. From the other same ribbon arch plier, I twisted it. See my both hands, I am twisting it 30 degrees. A wire is twisted. You cannot guess this, but the wire is twisted. If you want to check, see. Correct? Alright? Wire is twisted. Yes. Now, what to do? Mesodistal width, calculate, mark it. I am using a bigger part, bigger picture. Suppose this is the mesodistal width. This is the mesodistal width. Okay? So I am bringing this tooth close and bringing it back to the opposite side. Now, if you can guess, see this. There is a twist in the wire. Now you cannot see straight wire. So see?
Definitely my objective because I'm planning to do orthodontic case, single orthodontic case in my private practice. So by joining this course, I can know the diagnosis, how to treat patient. Because before this in undergrad years, we only exposed to more to the removable appliance, not to fix ortho.
Yeah, Dr. Ravi and Dr. Priyank, they've been very helpful, very approachable. The whole learning situation has been very relaxing, so it has been very enjoyable so far.
Previously, we know that braces works by wire and bracket, but the knowledge behind it, why we use this wire, why we put bracket in that position, we don't know. And then by enroll this course, and then we know the reason behind it.
Apart from that, they have also provided 5 years of full support for all the participants from this academy. So which I feel that is very beneficial. And let's say for us to start up with a case now, there's someone there for us to guide the case. So at least we won't go through any mistakes later on. So I feel that is a very good important thing that the academy has given us this opportunity.